Still on health, governments at all levels and development partners have been called upon to place polio eradication at the forefront of national health priorities and to accelerate broader immunization and primary health care efforts. This formed part of discussions among speakers at a mass mobilization dialogue with journalists, social media influencers, and youth reporters held at Husky Hotel, Mina. Correspondent Modu Keziah has more.
The chief of the UNICEF Kaduna Field Office, Dr. Jarida Birikila, represented by Bala Dada, emphasized that the goal of polio eradication remains attainable as long as momentum is maintained, by saying that critical factors include strong political commitment, adequate funding, high-quality vaccination campaign, and active community engagement, adding that every child has the right to protection from polio.
We can eradicate polio. Eradication is within reach, but only if we sustain momentum, political commitment, adequate funding, high-quality campaigns, and strong community engagement. Because every child deserves a life free from polio. There has been a lot of progress, but children remain vulnerable. There have been outbreaks that threaten the gains that have been made. These campaigns must reach all children, especially in remote, underserved, and conflict-affected areas. Strengthening routine immunization is non-negotiable. We must work together across borders to close the immunity gaps. We must identify rumors, misinformation and disinformation and stop them. Vaccines work, and the polio vaccines are safe, they are effective, and they are our strongest defense against paralysis and death.
He highlighted that strengthening routine immunization, fostering cross-border collaboration, and combating misinformation are essential strategies. In her remarks, the incident manager, Dr. Fatima Mohammed, said polio vaccine is safe for everyone, and most especially the children. And in order to fight against polio diseases, campaign is ongoing. She also added that polio vaccination will be for 4 days intensive implementation, plus additional 2 days mop-up.
Days that follow the days to 2025. So we're in 21 states. The target age group are generally 0 to 59 months, meaning everybody under the age of 5 years. Then operational target population 21 states, like I said, and we're looking at a population of 42 million of Nigerian under 5 children. So we have different strategies. There's the directly observed polio vaccines. This one, if they call it DOPP, they give directly observed. There's the way they check when they are giving.
She also added that the campaign will be happening across 21 states, and they will make sure that multi-sectoral collaborations are involved to ensure that every child is vaccinated. In their separate presentation, the Assistant Public Health Officer, WHO consultant, Mrs. Elizabeth Ishaku, and other UNICEF facilitators emphasized on the role of the media as an advocate that help in shaping the minds of the public, adding that key actions such as revitalizing primary health care, securing sustainable funding, expanding vaccination coverage, and actively engaging communities to build vaccine confidence in reaching the most vulnerable children by using innovative and tailored approaches.
But sometimes when they hear it from a higher person, all the media, or they watch it through the media, they tend to believe it better. So it is a very good avenue to be able to carry out most of our activities that
Polio mainly affects children under 5 years old. It most often affects unvaccinated children, but anyone who is not fully vaccinated against polio is at risk of developing serious illness. Polio virus is very contagious. The virus commonly enters the body through the mouth, in water or food that has been contaminated by fecal matter from the person who carries the polio virus. Infected people share the virus into the environment where it can spread fast, especially in areas with poor hygiene and sanitation.
You understand fecal oral feces of the infected person contaminating the food, contaminating the water, contaminating the environment, and now the next person that is at risk will now take the contaminated food into his own mouth and he become what? Infected.
The social listening and Roman tracking enable rapid responses to misinformation while integrating them with other health interventions, maximize resources, reduce duplication, and increase community acceptance.
They added that vaccines are safe, effective, and constitute the most robust against paralysis and deaths, saying that well-organized campaigns are vital for protecting children and reinforcing healthcare system. Umar Kezia reporting for NSTV News.